need to call this. And then just X out of it. Just close it out completely. Okay. Richland County Clerk Counsel's Office, this is Andrea.
Andrea, I'm just looking, I didn't see the.
Good afternoon, everyone.
Good afternoon.
It is 5 o'clock and we're going to call the Coronavirus Ad Hoc Committee to order for April the 28th. Ms. Mathis, if you will, please call the roll.
McBride,
Present.
Livingston,
Present, was on mute, present.
thank you. Joe Walker, Barron,
Here.
Newton,
Present.
we have a quorum.
Thank you. At this time, I'll entertain a motion for the approval of the minutes from February the 25th, 2021.
So move for the approval of minutes.
Is there a second?
Second.
It's been approved and second. Are there any discussion or anything that we need to add to the agenda? I'm sorry, to the minutes? Any corrections? If not, Ms. Mathis, will you call the roll?
McBride,
Yes.
Livingston,
Yes.
Joe Walker, Barron,
Yes.
Newton,
Yes.
motion passes.
The next item on our agenda is the adoption of the agenda for this meeting. Are there any additions, deletions, or changes? Mr. Brown, I did receive an email from you in reference to moving item 7, which is the federal vaccination site update. If we'll move it up, because we do have Dr. Trexler with us, who has a limited schedule. Is there anything else that we need to add?
No, Madam Chair, that is the request that she can give us an update, as well as maybe give us an update on the Jansen vaccine.
If there isn't anything else, I'll entertain a motion for the adoption
Madam Chair?
of. Yes, Ms. Newton, you're recognized.
Thank you, Madam Chair. Just a quick clarification on our agenda, item number 5, resuming in-person council and committee meetings. As part of that discussion, would it be appropriate to also discuss public participation and involvement in our meetings at that time?
Yes, that's all inclusive in that discussion. Is there any other additions or deletions or changes to our agenda? Given none, I'll entertain a motion to approve the agenda with the change of moving up our federal vaccination site update, adding and also an update on the Jansen vaccine.
Move for approval as amended for the agenda.
Second.
Thank you. So Ms. Mathis, will you call the roll, please?
McBride,
Yes.
Livingston,
Yes.
Joe Walker,
Yes.
Barron,
Yes.
Newton,
Yes.
motion passes.
So our first order of business on our amended agenda would be an federal vaccination site update, along with some updated information on the Jansen. We're delighted to have Dr. Brandon Trexler with us from SCDHEC. If you will, at this time, Dr. Trexler.
Thank you. Thank you all for having me, and I really appreciate you all accommodating me for the schedule, so thank you. So as you mentioned, I wanted to address a couple of topics. One of them is the federally supported state-run vaccine site that we have going on out at Columbia Place Mall on 2 Notch Road. That started, now y'all are gonna test me, I think on the 14th, 2 weeks ago today, yes, on the 14th. So I had to stop and think. They have given almost 5,000 vaccines already, I'm pleased to say. They've given 4,758 through yesterday. It is open from 7 a.m. to 7 p.m., 7 days a week. People do not need an appointment to go there. They do not need to live in Columbia, live in Richland County. We've had folks driving down the interstate, going on vacation or whatnot, and have seen the signs, and we're happy to have them. There's no ID or insurance information required. It's free of charge. So you can either do it the drive-through option or get out and walk in if you prefer into, I think it's the old Sears part. It's really easy. If you include the 15-minute waiting period just to be observed after you get your shot, you're in and out of there in 30 minutes easily. So we really appreciate, we've been putting that on with the support, obviously, of FEMA from the federal side, but also then from many of our state and local partners, including Richland County. And I want to thank you all. I had the opportunity to be with Mr. Brown out there at the kickoff event for it and meet some of you. And so thank you all for coming out. And so really want to just keep encouraging people to utilize that option. Also, and so right now they are giving the Pfizer vaccine. And so if you go, that is one that takes 2 doses to get the full effects, and they're 3 weeks apart, the 2 doses. So if you go now and get your Pfizer dose, then you still will have time. You can go back in 3 weeks through that exact same site and get your second dose. Then they will likely be beginning the last couple weeks that they are here. It's about an 8-week event, or about 7 or 8 weeks. They will be using the Jansen vaccine, which is that Johnson & Johnson one. You all probably have heard, that a couple weeks ago, Friday, they put a pause on use of the Janssen vaccine. The CDC and the FDA did. They had at that time reports of 6 or 7 cases of people with severe blood clots who also had low platelet counts, which is not something, it seems a little contradictory. That's not something where we see those two together very often. And so it did the right thing. The FDA and CDC said, hold on, let's pump the brakes for a minute. Let's investigate this, make sure that there's not something more going on that we don't know about, and gather more information on it. And so they did. They put out a call looking for any cases that might not have been identified. And they also made sure that, just wanted to make sure that hospitals and providers knew how to treat it, because you don't treat it with the normal blood thinning medicine, heparin. So they wanted to make sure that folks knew how to treat it and knew to watch for it. So this past Friday, the CDC's Advisory Committee on Immunization Practices, which is made up of people from all around the country, experts in that area of vaccines and immunizations, came together, and after 3 days, I guess that was the 3rd day of their pretty much all day discussion and poring over the data and deliberations and such, determined that they were going to lift the pause. And so they were going to go back to recommending that the vaccine be used. They asked the FDA to include some warning, just that there is this very low risk, but that it does exist with the vaccine. They ended up finding 15 cases. And that was out of almost 7 million vaccine doses, almost 7 million people, though, that had been vaccinated, found 15 cases. So very, very low rates. I believe 13 or 14 of those cases occurred in women between the ages of 18 and 49. So that's specifically kind of who the information is provided to, that the FDA includes now in their authorization, just making sure that women know that while it's very small, there is a slight risk of that, and that there are options, for the Pfizer or Moderna vaccine. We had immediately, when the FDA and CDC put a pause out there, nationally, when they recommended it in South Carolina, we directed all of our vaccine providers to stop temporarily using it, and asked them, we gave them specific instructions for how to store it, not to waste it, not to discard it, but just to store it, how to label it. And so then last Friday evening, when the CDC made their new recommendation, we then sent communication back out to them that they could resume using that vaccine that had been properly stored. And at some of our sites, we have begun and are beginning to use it again. So that is the status of the Jansen vaccine, and I'm happy to answer any questions you all may have on either of those topics.
Thank you, Dr. Trexler. So I would open up the floor if there are any questions from any of my colleagues that, whether it's for the federal vaccination site at Columbia Place Mall or about the Jansen & Jansen vaccine. Are there any questions? Yeah, Mr. Malinowski.
Thank you, Madam Chair. Dr. Trexler, you stated early in your talk that there was no ID required. If there's no ID required, how do you know the name being placed on the vaccine card is a correct one?
Well, so for the most part, we are trusting that the person is self-identifying themselves correctly.
Okay, thank you.
Ms. Newton, you're recognized.
Thank you, Madam Chair. Quick question. Could you repeat the date that you said you were going to switch from?
Ms.
If
Newton? If you would repeat that, you went out on us.
Sorry, can you hear me now?
Yes.
Sorry about that. I thought that I heard you say that at a date certain we were going to switch from the Pfizer vaccine to the Jansen vaccine, and I was just wondering if you could repeat that date, please. Thank you.
Sure, and I can get you the specific date. I know that it is that the plan has been to do roughly 6 weeks of the Pfizer and then another 2 of the Janssen, but I can get Mr. Brown that exact date when that switchover will occur.
Any additional questions, Ms. Newton? Okay. Are there any questions, any other questions for Dr. Trexler? If not, Dr. Trexler, thank you so much for the work that you're doing for the state of South Carolina and also for the citizens of Richland County. We can't wait. We're telling everybody don't wait to vaccinate. And so we appreciate all your efforts. And we are resounding sounds. We are with you 100%.
Thank you. Thank you all. And thank you for your support. And I agree. Don't wait, vaccinate. And I'll get Mr. Brown that date.
Thank you so much. Our next order of business is the Emergency Rental Assistance Program update. Mr. Brown.
Yes, ma'am. I'm going to touch on several different areas with this. I'm going to also have Mike King to help me out. The first thing I want to do is start with an item that I showed you previously in a council meeting. This item, I'm going to share my screen, is an update as of the time that I prepared this slide for you. So it's not up to the minute, but it is going to be as of yesterday. So I'm going to share this right now. And what you're going to see is where we stand with our approvals. And so the screen that you're looking at right now shows you the number of applications that have been approved to date. You'll see that there, which is 75. Again, this was as of 4/27/2021 in the evening, so yesterday evening. And it shows you the breakdown of how the payments were made in terms of whether or not they were arrears and whether or not they were for rental, then whether or not they went to the landlord or the utility company, or whether or not the payments are scheduled to go to the renter. So you see that breakdown there, and you see that the total approved amount for those 75 applicants in total is $441,575.53. So you can see since the last time we reported in the council meeting, roughly about $173,000, how much more funding has actually been approved going through the process. So certainly want to say thank you to all of the men and women who are supporting this effort in going through the approval process and the eligibility process and a quality assurance review to make sure that as these funds are approved, they're meeting all the federal regulations associated with this program. but you can see that we are moving this program right along, and folks are getting those fundings that they need. So I'll just stop there for a quick moment to see if Mr. King has anything else to add before I pull up another screen share, Madam Chair.
No, sir, I have nothing at this time. Thank you.
Okay. Do you have any questions for me, Madam Chair, or members of the committee related to this particular item, this slide, I mean?
Yes, so, and you may have it in a future slide, but I know we had a discussion about looking at possible projections of applications that were received, but yet we're waiting on some supplemental documents. Could you speak to that a little bit?
Sure, I'll have Mr. King speak to that, and I'll kind of layer that with the conversation that we had with some other jurisdictions who are providing this program. What we've been able to realize is that some other jurisdictions, they took applications in kind of like a dump. So they got an application dump. They went through all those applications before making any awards. And in doing so, they used that data to project out how much requested funds they were going to have to address. Whereas in our situation, we opened up the program and had people apply. And as they applied, we went through and saw the need, and we addressed the need in the immediate way. We didn't get a data dump and then start processing. We processed once we started opening up. So I'll say that, and then I have Mr. King weigh in on that information as well.
Thank you, sir. And our eligibility specialists are working very diligently, as you can see, to get these applications approved and make sure they're compliant with both federal statute and Treasury requisites. And they do work with the one-on-one with the applicants. And that is probably the largest issue we have, is the applicants getting all the data in. And so what we have to do is work one-on-one with the applicant. And again, keep in mind that the applicant is allowed 21 days. So they have 21 days before we have to say, look, we're either going to get the data or we're going to have to decline. So they do have some time period. Also, we're dealing with landlords, and landlords actually have 10 days, 10 business days in which to get us back that data. But as you can see, our eligibility specialists are working diligently. They're getting these applications approved. And again, from what we hear is at this time, as far as the funds being issued, we are checking with different jurisdictions. And as right now, we are one of the few in the state that are actually are issuing checks or approving these payments. Recently, if you look in the media, the South Carolina just announced, the state of South Carolina just announced their ERA program. And what the announcement was, is they're announcing that they're going to announce it. So there is no date set. So we're already moving forward. Again, what I'm trying to do is build a coalition with our 7 counties in South Carolina who have receive direct allocations, and we're building a working email talk group with each other to share our ideas, our recommendations, our lessons learned, our suggestions, and it's being met very positively. Right now, so far, I've spoken in person with Berkeley County and also spoken in person with Spartanburg County, and they're very excited to provide us the information, data, and we'll share our data. So there's a lot of good ideas and a lot of good recommendations out there, and really great interest us. We've had a lot of questions. Well, how are you doing? We're referring everybody to our website, and that seems to be very, very popular. If you look at some of the other websites, it's kind of difficult to find out about the program. With our website, with the frequently asked questions, our policies or procedures are up front. I think we have a real, very open, very transparent process for folks to apply and get approved.
And so, Ms. Barron, to answer your question, our process, we take information actively. So in order to project, we would have to have that information kind of pooled in order to grab that data. And we actually take that information live and process it, other than taking a pool of applications and then beginning to see what we may need to do. We process them individually live. So we can try to work on pulling some overall projections, but it's a little different with our program because we're not waiting we're processing as we get them. We're not cycling in a pool and then doing distributions and then going back and doing another pool of applications, then going back and doing distribution. So it makes it a little bit more challenging for us to pool projected data in the same manner.
Understood. I was just kind of trying to do a little calculation and forecasting, but thank you so much, Ms. Newton, and then Ms. Mackey.
Thank you, Madam Chair. Can you hear me?
Yes.
Thank you. Mr. Brown, I feel like my question is different from Ms. Barron's. And so if it is not, feel free to say, see previous. I understand what you're saying about not processing in batches. And I understand that you're taking the applications live. I just want to make sure, because you can mean a few different things when you say the word projections. My question is, when you look at all of the people that have applied, whose applications you calculated live, looking at the amount of rent that has been requested or utilities funding, can you tell us what the total requests are? So I'm not asking you to project how much you're going to approve, because there are a lot of different factors that go into approval, but can you give us an idea of how much rent and utilities assistance has been requested? Did I express my question clearly?
I think that you did. And I think that the answer to your question is we could have Tetra Tech to do that based off of the request alone, not backed up with the actual data that goes along with that to get that answer. But I would just say that it may not mirror what the applicant is actually eligible to receive. So to keep it short,
Yes.
if they request $10,000, but their rent is only $2,500, and they can only provide us documentation for $2,500, then the actual number would be limited to $2,500 for eligibility, but the request may seem more. So yes, ma'am, I believe we can do that and get that to you.
Correct. And so I would like to see that information, understanding the caveat that you gave, because a lot of times whenever there's a limit to what you can request for, people request the max, but that at least can show us an additional data point for what is being requested. Certainly, I understand that this is very time intensive. And as I watch the clock tick down to September, I'm just hoping that we can correctly expend as much funds as possible. So I would like to see that data. My next question is, and we may have addressed this at a previous meeting, as we look at the reimbursement of utilities that are in arrears, what is Richland County doing to see if some of those funds might be available to Richland County utilities customers who might be in arrears?
Yes, and we can address that. I know that question came directly before to Mr. King when we're going through this process. Mr. King, would you like to address that, sir?
Yeah, we're working with Assistant County Administrator Thomas and their utilities department, and we're tracking right now. The utilities department, through their billing department, they're assisting us. They are receiving monies from the ERA program, which have been requested. They're part of the utilities such as Dominion, Verizon, the City of Columbia. So they are receiving, and that is part of the process for that. Again, I don't want to speak on behalf of the Assistant County Administrator, but I do believe that they are putting information out on the billing. And also they have the information in their service department, their customer billing service department. When folks call in, they have the information for the program. And also we spoke with, had the pleasure to speak with Dominion, and they are also really helping us promote the program, both on their, as the bills go out, and also again, in their customer service department. When folks call in, they're going to have information on this program to assist them. And same way with the City of Columbia with their utilities department. So yes, the money is coming in, and again, it'll grow as this program grows.
Perfect. And Madam Chair, may I ask one final question?
Yes.
Thank you. My final question is, as we look at this program, ensuring that every eligible Richland County citizen is aware of the assistance that's available to them is absolutely critical. And so we have had previous updates on how we are spreading the word. I wondered, are there any additional outreach channels, communication vehicles, partnerships? What else are we doing to expand knowledge of this program? Because I would really hate for people to not know it's available, particularly people who are in crisis might not be going to the usual places to get information. And with that, that's my final question, Madam Chair. Thank you.
That's a great question. Should I answer that, Mr. Brown?
That's fine. You can go ahead, Mr. King.
I want to brag a little bit. Our team has been really working. We're working with the Public Information Office and the Government Community Services Department. And we have really been working aggressively to get the word out on every possible aspect. And that's another reason that I've been contacting our county partners and the other 7 counties to kind of see what they're doing. And we're going to have that information because, again, they may have some ideas, some recommendations, some suggestions that we have not thought of. But one of the things that we're really excited about is we're going to take advantage of getting the word out on every opportunity we have, such as when we saw that media release about the state's ERA program, which they are going to announce or open it at some point. They haven't announced the date yet. We're going to take advantage. We're going to add on to that media, because if you read on that media release for that program, way down in the media release, there's this little article, a little line that says, oh, by the way, if you're in these 7 counties, you really need to go through your local program. So we're going to tag team off of that, and we're going to actually promote that, working with our PI to local media and say, look, yes, that figure looks big. It's $273 million, but you're in one of the counties that program's already active. It's already working. This is our program. This is how you work with our program. Also, we're working with the City of Columbia. City of Columbia announced a housing relief fund. And so I requested a meeting with the City of Columbia and the cooperative ministry. And to make sure really 2 things is, number 1, that we're not duplicating our efforts. And second, that we're not putting our residents in a hazardous situation where they're duplicating benefits. We had a Zoom meeting, about an hour-long Zoom meeting this week. It's very, very beneficial. And basically, they have not kicked their program off yet either. So they really had a lot of questions about our program. And we really were able to provide them a lot of assistance on operating this type of program. But what we found out is their maximum relief is $3,100. And that's for either a mortgage, they do assist with a mortgage, or rental or utilities, not a combination. It's one or the other. So it's up to a maximum $3,100. So we're working with them because individuals that they might be approving for their $3,100, they're still going to have quite a gap in funding. A lot of these individuals are going to have a lot of gap in funding. So we're going to be working hand in hand with them. And that way, if they do have applicants that do get the $3,100 or may not qualify, or they don't have the money, they're going to refer the applicants to us. We are really pleased about that. And then we also had opportunity to speak with cooperative ministry about getting the words out and with their partner, both their faith and corporate partnership. And then we are just ready to kick off a big media blitz with the, especially with our limited or non-English proficient citizens through the Spanish media channel. So we're just getting ready to kick that off. Our PIO has been working very diligently on that. And another thing, working with our Government and Community Services Department, they have developed an email listing for 175 churches or faith institutions throughout Richland County. We are reaching out via email to each one of those institutions, seeking their partnership, help, and providing them information that they can provide to their congregation as well as their faith partners to get this information out. Another cool thing we just initiated today is we're going to be working right now with Richland 2 schools and hopefully with Richland 1 schools with the caseworkers there, social workers, on training the social workers about the program, training the social workers how to enter the information and how to promote the information, because a lot of times these social workers actually have a lot better contact with the family, especially families that are in need in their school district. And then that's about it. But we got a couple other cool things with the SBA. I don't know. We want to talk about that, but that's later down the road. But that's a restaurant revitalization fund that we're working with the PIO, getting that information out. But we really are doing about everything and anything we can think of, and we're open to any suggestions about what else we might be able to do. But we're really trying to get the word out to everybody as quickly as possible and as completely as possible. I hope I didn't take too much time, but I wanted to brag a little bit on our team. They're doing a great job with it.
No, thank you, Mr. King. I think that it's definitely noted that you guys are doing a fantastic job in getting the word out, and then also getting the funds back into the hands of the citizens. So we appreciate that. Ms. Mackey.
Yes, thank you. Yes, thank you, Mr. King, for that information. That was part of my question. So I'm very glad to hear all of the efforts that you all are doing to get the word out. The other piece of that I wanted you to touch on, if you could, is when you are receiving the applications or talking with applicants, are we tracking where they heard about the program? Like, so to kind of figure out what has been working well for us so that we can have that information for future use, knowing what are the channels that really worked well.
Not at this time, ma'am, but that's a good suggestion. I can certainly run it by our programmers on our software to see if that could be part of the question.
That'd be great. Thank you.
Ms. Mackey, if I may respond to that,
Yes.
that is a very good question. I would just say that probably at the time when we were going through this process, one of the things that we were trying to do is we only really put questions on the document that were absolutely required, and then the minimal information so that applicants would not feel overwhelmed. So it's kind of one of those things that we definitely overlooked in trying to make sure that we just limited what applicants were being exposed to. But that's a very good point.
Got it.
Anything
That was
further?
it. Thank you. No, that was it. Thank you.
Are there any other questions relative to the emergency rental assistance program?
Ms. Barron,
Ms. McBride?
I'm sorry, I didn't realize you had a question.
Okay, I don't have a question. I have a brief comment. And I'm glad to see all of the efforts that are being put into trying to make this program successful. And I've already sent a letter to you all and to Mr. Brown regarding some of my concerns. And I think that some of them have been partially addressed. I still would like to see a more concerted effort in terms of actually working with the faith-based communities and communities that are, and entities that are inside of the underserved areas, as well as the magistrate office. I don't want to take up a long time with this meeting. I will continue to advise Mr. Brown and council members as I write the comments, and look forward to those areas addressed. Sometimes our churches are overworked, and given coronavirus, there's limited staff. But the faith-based area is a place where people go for assistance. And sometimes those faith-based entities need assistance in order to help the people that we're trying to reach. So I would like for you to further investigate how we can actually assist the faith-based entities rather than just giving them work like we assist other programs. Thank you.
Thank you, Ms. McBride. I think that is a noted point, and perhaps Administrator Brown and his team, Mr. King, and even Ms. Kiefer could look at possibly some type of information session that can be hosted at these faith-based organizations or these worship centers, given that very, very few of them are open for in-person, but perhaps they may entertain some type of information session that we could offer for them. Just kind of throwing out some ideas here, because I do agree with Ms. McBride. The faith-based entity in the church is the center of the community. Whether you go to church or not, they're there, and they are a resource that people will go to in the time of need.
Yeah, and I have some other comments beyond informational sessions with them, Ms. Barron, but that is also one of the areas. And again, I will speak to that, not taking any more time here.
If I could add, in response to one of Ms. McBride's comments, we have reached out also. I forgot to have that on my point. We have reached out and we are working with the magistrate's office also in this program because of a lot of the eviction issues that they're facing in the magistrate's office. Sorry, I forgot that on my point list of what we've been doing for outreach.
Thank you. That's one of the areas that I had also identified. So I appreciate that, Mr. King.
Thank you. Ms. McBride, anything further?
Not at this time. Thank you.
Are there any other questions or concerns to be addressed for Administrator Brown or Mr. King in reference to the ERA program? If not, thank you, Mr. Brown and Mr. King, for the work that you all are doing and your team. Let's just keep it going. As Ms. Newton has stated, I think that it's critically important to keep in mind that we're on the clock and that we want to expend as many of those funds as we can before the September date.
Yes, ma'am. Thank you.
The next item on our agenda is resuming in-person council and committee meetings. Mr. Brown and I had an opportunity to discuss this, and we kind of bounced around a couple of options that we just want to open up for some discussion tonight. And possibly depending on how this discussion goes, we may be ready to take something to full council. But one of the things, as we know that our county is opening up, our children are going back to school. Our staff here in Richland County are back, and so we feel as though that perhaps it's time for us to evaluate if it is indeed time for us to return to into the chambers or to return to in-person meetings. And so one of the things that I'd like to bring before the body today is to consider that we would go on the timeline of the forecast that Mr. Brown has put in place for opening in-person services, as I say, 100% for all of our county offices. The slated date or the tentative date is July 1. And it would be great if that council would consider also following suit with that date. Given that, I've talked to several of you and had the opportunities to kind of do a temperature check to see what your thoughts are as it relates to returning the chambers. And many of us have some of the same concerns that perhaps we're ready to move back to in-person meetings, but the chamber may not be conducive for us as the council to sit at the dais to comfortably. Also, it does limit the number of people. We see here the number of staff members that we even have that attends all of our meetings and attend all of our committee meetings. When we look at that, we limit the number of the citizens that can come in. And we want to, while we've been taking citizen input the entire time of coronavirus, just a little different. We had to do it in writing, but the input was given and the opportunity was given. So the proposal that I have for you all is that we would resume in-person meetings, council and committee meetings, but perhaps choosing an alternative location, looking at facilities that either the county owns or the county is in partnership through millage agencies such as R2I2, which is in Richland 2. I've spoken to Dr. Davis. He's on board with hosting us at R2I2 or any of the other schools that they have. I've talked to the board chair at Richland 1. They're also on board for hosting us. We have a call in to Midlands Tech. Allen University has agreed to host us. Richland County Parks and Recreation has agreed to host us at any of their facilities, as well as Historic Columbia. So these are organizations or agencies that have already said that they not only have the capacity to host us, but are willing to host us. This will also present an opportunity for us to be able to go into the community and to those individuals that we serve, not hosting them all in the same districts, but moving around. So this is a proposal that I'm giving. It's not concrete. It's one of which that, that when speaking with Mr. Brown, we really had some conversation about it. And I do see Ms. Horatio and Ms. English's hand, but before I take the comments, I would like for the administrator to weigh in his perspective on in-person council meetings, as well as committee meetings from the administration standpoint.
Thank you, Ms. Barron. I certainly would say that I'm very much interested in sending a unified message, both to our employees as well as to those community members who are looking at how we may be operating as an organization as a whole. So as we are planning on opening up access more broadly to the public, effective in July, I think it certainly makes sense to send a consistent message that if we are saying that the public can come in and move about, that we can do that together, both as administration and as council. So I don't have any issues with that, and just need to know, what, if any, alterations council members may want us to provide as they meet in person.
Thank you, Mr. Brown. So we have Ms. Horatio, Ms. English, and then Chairman Livingston.
Thank you, Madam Chair. I just wanted to, I raised my hand before. So I just want to voice my support for taking this opportunity to move council meetings around the county a little bit, give different kinds of people, different people access to us in a different kind of way. I just think we can take something that is an unusual circumstance and make it into something that really positive. And just want to express my thanks to those who have offered the use of their facilities for us to meet.
Thank you, Ms. Horatio. Ms. English?
Thank you, Madam Chair. I'm in line with Councilwoman Horatio. Can we also add the Township Auditorium to that list and just kind of see what availabilities they have as well? That was it. That was just my only comment for that.
Yeah, so the township is on our list. I did overlook it. I apologize. And so with not only with the township, but with all these other organizations that I've reached out to, we didn't reach out to them with specific dates, but just to entertain, to say, hey, are you interested in hosting us? So the township is indeed on that list. Thank you for that reminder, Ms. English. I have Chairman Livingston, Ms. Newton, and then Ms. Mackey.
Yes, and I certainly agree with the idea of perhaps considering having meetings move around, but there's a lot that goes into that. I'm not sure how we're tying that into resuming meetings at the council chamber and committees. That might be an item the council full council to take up at some point, but I'm not sure it's directly related to or not related to resuming our in-person meetings. So are we talking about having meetings in July when we start back at different locations? That would be kind of problematic, kind of arrange that, I think. So let's be careful about how we're going to manage and make that happen, and whether or not we want to tie it to just the committee or something general that council be considered.
So thank you for that point, Mr. Chair. And we are talking about resuming in July, and this would be working alongside of the Ms. Kiefer and her team, as well as some other identified staff members to ensure that we have a smooth transition. And so I would like to hope that we wouldn't move forward with anything without having a concrete plan in place to be able to move forward. with that. So that is noted, sir. Ms. Mackey, you're recognized, and then Ms. Newton and Ms. McBride.
Thank you. I wanted to, I guess, make a comment about a few things. I am definitely in support of us figuring out a way to get back having meetings in person in a safe way that works for staff and for council members. And then I also, I guess as far as meeting in different locations, I do have a little bit of concern about moving around at different locations. Consistency is usually best for the public to know that they can go to one spot at every meeting time, every first and third Tuesday. So I do think one place is better. But looking at cost, I know we talked about a lot of places, but I don't think that we should be paying to meet at any location. So any location that would cost us additional money for technology needs or setup, I don't think is in the best interest for us to go that route. So I would like to see more of a plan of what does that look like and what location would work best that would not cost us money. And then also really looking at, do we have a plan for once we go to opening back up to in-person meetings, are there protocols in place or standards that say if numbers start to rise again with cases, that we're going to then maybe scale back again to protect even staff working in offices. So I would like to kind of make sure we flesh all those things out before we move forward with fully opening back up our meetings and opening up county offices.
Yes. Thank you, Ms. Mackey. Mr. Brown, did you want to address any of those items that Ms. Mackey had mentioned? And I was thinking specifically to the protocols in place should numbers rise.
Sure. So that's something that certainly we can provide to council just to make sure that we are in agreement on that. I think that's really what we have to determine whether or not we're going to follow, because my recommendation would be able to follow our local and our federal health agencies. But that's something we have to determine whether or not the council ultimately agrees with. We want to lock ourselves in because last year we saw several agencies lock themselves in and then they had to violate their own protocols because the numbers never got to where they could do what they were doing. So that's something certainly Ms. Mackey and Ms. Barron, I can share with you, and then we can talk about, as the council, talk about what modifications we might want to make to any strict numbers or strict data associated with these plans, because COVID-19 has taught us all that we need to be flexible and consider multiple points because sometimes the numbers themselves will not be in our favor.
Yeah. Thank you, Administrator Brown and Ms. Mackey. Also, to your point, we are exploring the options. Definitely, we don't want to add a cost onto us by us coming back in person, because we already know that we do have a place that we can meet that doesn't provide any additional cost for us as a council. So that is definitely going to be noted as well. Did you have anything further? If not, Ms. Newton and Ms. McBride.
Thank you, Madam Chair, and thank you to my colleagues who've expressed many of the things that I feel. So 3 points for me, and then as a question first. I wholly support us finding a way to come back and be together. I think it is important for us for all of the reasons that we've discussed. And to your point, Ms. Barron, that you mentioned, I also want to support the idea that we have standards and protocols that staff is going to propose. Some of the things that I think would be important would be that we as council members are able to maintain whatever the level of appropriate social distancing is, that we look at having space for the public, but also what is going to be the protocol for how we're going to set capacity, how we're going to communicate capacity, mask requirements, those kinds of things. And then also to Mr. Brown's point, I think that we need to have standards and guidelines, but I'm fine with those being flexible, but I would like to see us have those. The fact of the matter is that we are almost in May. If one of you knows exactly what the situation on the ground is going to be like come July 1st, please call me, because I would love to know. So I think we have to be able to anticipate what those changes are. So I'm fully in support, but do want to make sure we see those guidelines to where we're doing everything that we can to ensure safety, because while it's true that the code, we're also still having physical distancing with our staff. We're also providing safeguards. And so we want to make sure that we're doing the same thing for our constituents and allowing our constituents to send in their comments, to participate in their meetings. But I know I can't speak for others, but in my district, I'm really just hearing a huge outcry and desire of citizens to participate in a more meaningful way in our sessions. Reading an email is always the same as having a person have their own voice heard and being able to make eye contact with council. And so my request would be, can we talk about, let's say we do set this July 1 date with whatever the standards that we're going to use, what are the ways that we can make citizens in meetings more robust and
Miss Newton, you're breaking up.
Yes.
You're breaking up.
Okay, all right. So my question to you.
I think she said she's going to send her question to me. So if that's the case, Miss McBride, if you'll go ahead and take the floor, and then I will, when I get her question, I'll ask it.
Okay, I'll be brief because we don't have a long time. I concur with much of what has been said, particularly with Ms. Mackey's concern regarding the logistics of moving from one place to another and the consistency issue, as well as the cost. I'm sort of a data-driven person. And in the past, when we've tried to do some of the outsourcing the meetings, we really didn't get any more participation than we did, less participation, in fact, than we did when we had it at the county office. So I caution, and I think it's good to have 1 or 2 meetings out, but the consistency of knowing where you're going to meet is very important. And the logistics of meeting from one place to another place sometimes is really terrible. But I support 1 or 2 meetings out, but the consistency of meeting one place is important. And if we're asking our citizens to come to Hampton Street, then I think we should make it possible for us to meet here. Thank you.
Thank you, Ms. McBride. I haven't gotten a question. Oh, here we are. So I got one from Ms. Newton. What can we do? What can we do better to allow the citizens to participate in meetings and feel engaged while we wait to come back in-person meetings? So I'm going to interpret this, and Ms. Newton, if I'm interpreting it wrong, just text me. But it sounds like in the meantime, while we're still discussing whether or not we're going to go back in person, how can we beef up or change how citizens engage with us during the meetings? I think that she said yes. So what else can we do? Because right now we know currently they can submit a letter, and as long as it doesn't pass 2 minutes, then it'll be read into the record the same. And so we're looking at different ways to engage our citizens. And so she wants to put that out there for us to present a proposal, or to kind of think through, if staff, Mr. Brown, if you all can kind of think through some other opportunities or some other ways that we can engage the citizens. I know I've heard from some of my constituents, while they have submitted letters, they would have preferred to have been in person, or to have been able to call in. And I know during our town hall meetings, that is an option for individuals to call in to to our town hall. So perhaps that's something that we could look at.
Yes, ma'am.
Okay, thank you. So anything further about the resuming in-person council meeting and committee meetings? Ms. Mackey, I see your hand.
Yes, thank you. I guess if I could add on a little bit to that, looking at options, but also making sure that we are evaluating the technology that we currently have as well, and are we fully utilizing that? And I think just an example of that is we stream live on YouTube, but do we have someone sitting there answering questions as people type in chat live during a meeting? And I think we have a lot of tools that we need to evaluate how we can better use those, but then also look for new technology to help folks engage.
Very, very good point. Very good point. So if there are anything further on this matter? If not, we're going to move on to item number 6. I know we're getting tight on time here, but item number 6 is just to get the thoughts and the feedback. Mr. Brown and I were meeting, and we wanted to perhaps present to the body and to the committee an opportunity to get your feedback about doing some form of COVID-19 memorial, something to the effect to say that we acknowledge the fact, the loss of life during these hard times, during this during COVID-19 over the last now 16 months. We acknowledge it. And so a couple of things that came out of that conversation was perhaps doing a somewhat like a wreath laying at 2020 Hampton with some short ceremonial opportunity, and then have citizens can come. We'll have it on the property there for a week or two. Citizens can come for those who have lost a loved one during this time. And just we want to commemorate the loss of life at this point. I will open up the floor at this point for any feedback. Okay, well, we'll move right along with that. The next item on our agenda is the relief funds. Oh, I'm sorry, I see your hand, Miss English.
Thank you, Madam Chair. But any time to recognize that, I think would be awesome. We need to understand that so many people, they didn't just die, but they died alone. And this would be an awesome opportunity to say your loved ones mattered, you mattered, and I think that's a phenomenal idea. So excellent idea, and I applaud your committee for just coming up with that. So yes, we have to remember that so many people died alone, and it was a hard time. So thank you guys for that.
Thank you, Miss English. As many of you know, my oldest brother died of COVID-19, and it is one of those things that you never want anyone to experience, to be able to die alone or to even die for that. And it's one of those things where we want people to know that their loved one mattered to us in Richland County. I definitely think it's an opportunity for the softer side of Richland County to present itself. Mr. Chair.
Madam Chair, I'd like to move that we ask administration to put together some kind of idea, proposal about a memorial for the COVID-19 victims and bring that forward to council.
So
that would go to full council. That's a motion to go to full council to consider.
I'll second it.
So there's a motion and a second on the floor for the COVID-19 memorial to go to council after the administrator and his team put together a proposal to present to us. Is there any discussion? I think that's right. Given none, Ms. Mathis, will you call the roll for this vote?
Certainly. McBride,
Yes.
Livingston,
Yes.
Joe Walker,
Yes.
Barron,
Yes.
Newton. Newton. Motion passes.
So, Mr. Brown, we will look forward to receiving a proposal to full council for the COVID-19 memorial. Thank you all for that. So we'll move to the next item on our agenda, and that is just an update from Mr. Brown on the relief funds that we are slated to at some point receive from U.S. Treasury.
Yes, ma'am. And I will be brief. Hopefully, members of council gotten this information emailed to you. It is a document that communicated some of the breakdown categories of the American Rescue Plan. We are still actually waiting on the actual detailed guidance from the Treasury and the associated funding. We have received neither at this point, and not only us, but it's consistent across the board. But some of the potential uses are in that document. And I'm certainly looking forward to additional feedback from council at a later date of some opportunities that you feel as a body you would like for us to consider. Two of the things I would just tell you that I mentioned to the committee chair. One has been mentioned here, and that is using those funds to really attack our technology needs. I think that will help us be able to better engage with the citizens. And then also utilizing parts of that funding to address supplements to our first responders who were out and on the front lines of the pandemic. And the only caveat that I would be making to that is I believe we do have a group of individuals who were put in a first responder situation when they're normally not in one. And that is our operational services, housekeeping staff who were called out anytime there was a request to disinfect, desanitize, and otherwise make clean areas where there were cases of COVID-19 exposure communicated. So those are just two of the areas, but I'll share that with you, and hopefully you can review that document and provide some feedback either via email or at a later discussion. Thank you very much, Madam Chair.
Thank you, Mr. Brown. So what I would like for the committee to do, to take an opportunity to read, to review the document that was sent to us. And as Mr. Brown stated, please send him some ideas. And then in our next committee meeting, we will have some further discussion about some specific items that we would like to see take place with these funds. The next item on our agenda is the review of the mask ordinance. Currently, our mask ordinance is scheduled to expire on June the 5th. This morning, we had an opportunity, Chairman Livingston and Administrator Brown and myself joined members of the City of Columbia with the Mayor, Steve Benjamin, the City Manager, Teresa Wilson, amongst a couple of other staff members who joined us to discuss how we would move forward with our mask ordinance as the CDC is changing how it's communicating the wearing of face masks and face coverings. And so we wanted to just kind of let the committee have an opportunity to hash out for a brief moment here thoughts as we move forward. We do not want to wait until June the 5th to have this discussion, but we want to be able to, if it's something that we need to make adjustments. One of the discussions that came out of the meeting this morning was perhaps that we would suspend our mask ordinance and then given guidance specifically to allowing the citizens to interpret what the CDC guidelines are. Then there was other discussion to say that perhaps we will revise our or amend our existing ordinance to reflect such language that would embody the CDC guide or guidelines. So whereas we're leaving interpretation, if we suspend it, we're leaving interpretation for the citizen. But if we amend or revise it, then we are giving that interpretation as an ordinance. We're hoping that moving forward, that the City of Columbia and Richland County will work in tandem with our language and with our verbiage, so that we'll, as I like to say, we're one band, one sound. So if you're in the city, limits, the ordinance will be the same as if you're in the county. Administrator Brown or Chairman Livingston, is there anything else that you'd like to add that came out of that meeting this morning?
I think you covered pretty much what I heard. Another option was just simply to leave the orders the way it is and allow it to expire.
Correct. Mr.
But
Brown,
the main thing is the idea was just get some, feedback from this committee in terms of what the committee believes what we as a council.
yes, sir. Mr. Brown, is there anything else that perhaps I left out from our meeting before we open up for discussion?
No, ma'am. Just the discussion was the big key. So I'll mute myself now.
Okay. So at this point, we will open up for discussion to get some feedback from committee members and council members. I see Ms. Terratio with your hand.
Thank you, Madam Chair. I think that I had a one-on-one discussion with a city council member, and I'm sorry if I missed this in part of your report out, but was there a suggestion that if the ordinance were reapproved, that it would be maybe for fewer days rather than the 60 days? Was that part of the discussion or no?
That was not a part of the discussion, but as we are having this discussion today, if that's something that we want to explore fewer days, then that is also on the table.
Thank you, Madam Chair.
Yes.
Yes, that was just part of one of the things that came up for me personally. And even though we would have to vote more often to renew it, it would be a shorter time frame. And I'm happy to hear feedback on that.
Ms. Terratio, part of the issue was, particularly with our ordinance, remember, it doesn't expire until June 5th. So the question was whether or not council want to do anything even prior to June 5th. So expiration not an issue right now because it's in effect until June 5th.
Okay, and are you all thinking that it might not have to be renewed? Is that part of the thinking?
Well, part of the thinking is that not necessarily that it won't be renewed as much as it is, what is the good of the body? Is the body thinking that perhaps we need to make some modifications to our existing ordinance? And if that is the case, then we could do that prior to June the 5th. So if we'd like to make modifications, whether it's to change our verbiage or change the days, whatever the case may be, we want to talk about doing it prior to June the 5th, or if we would like, to go to June the 5th and do something totally different, But I think to the chair and chair, I don't want to put words in your mouth, but if we're going to make some changes, then why wait to June the 5th?
It might be the best time.
So I see your hand, Ms. Mackey.
Yes, thank you. I would, if I guess we make a request that the city's ordinance and be provided to us, because I really would like to see exactly where the key differences are. And I would like to look at that sooner rather than later. I don't think at this point, we're at a place to say yay or nay if we plan to extend it again, but I would like to see what the differences are so that when the time comes, I've already reviewed it and we can move a little faster if need be to make the change.
Thank you. That's a great point. Administrator Brown, can we make sure that council gets a copy of the city's mask ordinance?
Yes, ma'am, I can, Madam Chair.
Thank you. Miss McBride?
Yes. Our ordinance ends, I think, Mr. Livingston, June 5th. So we have just about a month left. COVID is very fluid. And so it's fluid, so we don't know which way it's going, but it looks like it's going in the right direction. It's just my personal opinion that we should prepare to look at something after June 5th, but I can't see us going before June 5th and amending the ordinance with such a short period of time. Just my beliefs. Thank you.
Thank you, Ms. McBride. And all of this is just so that we can get a good pulse on how we should move forward with things. And so are there any other comments or concerns?
Yeah, let me just say that I'm going to talk about how and why this briefly came up. The reason why this came up was I was having a brief conversation with the mayor, and the mayor was saying they were thinking about the ordinance and whether we'll do anything with it or not, because it's going to be coming up to expire soon. And so let's get on, see, can we get on the same page in terms of whatever we might do. So that's how it came up. And at that time, then I spoke to Mr. Brown, and we suggested that for the county, myself and Ms. McBride and Mrs. Barron, who's the chair of the Ad Hoc Committee, just get together, just have a brief conversation and to see where that goes. So that's kind of how this came up. There wasn't no need to try to do anything quickly, whatever, but just at least have a discussion about it. And the discussion may be, let's do nothing, continue doing what we're doing or whatever, but we didn't want to just leave it out there and not having a discussion to bring to your attention.
Thank you, Mr. Livingston. Is there any further discussion as we look to move forward with reviewing the mass ordinance?
Madam Chair.
Yes, sir. Mr. Walker, you're recognized.
It's Joe Walker.
Yes, sir.
Thank you, Madam Chair. Little bit of clarification from me, please, ma'am. The CDC recently released new guidelines indicating that if outside and appropriately distanced, that the data said masks were not warranted. I'm just curious why we would in any way not incorporate the updated guidance that's been provided at the federal level, given I just recently heard one of my colleagues say that they're a data-driven decision maker. What better data than the CDC, which is what we've been attempting to follow all along, than to implement into our current ordinance. And I'm curious if that is the direction the city is heading, and the impotence really for this conversation, and why we would not immediately allow the liberties associated with the CDC guidelines as it compares to our current ordinance to our citizens if they are in fact data-based and data-driven.
Mr. Walker, that was part of the discussion, yes.
So again, my question stands, why will we not immediately incorporate the leniencies associated with removing restrictions on our constituents versus continuing to impose them when in fact the CDC itself is saying it's not necessary?
So to your point, Mr. Walker, some of the conversation that we had today was exactly what you're saying, is to look, how can we look at what we currently have and what the CDC just provided us on yesterday and merge that language into either a revised copy, a revised ordinance, or how we should move forward. That's really the question that's on the table for us at this moment, is given what was presented yesterday, how should we move forward as a county? And so that's why we're having this conversation to determine, is this something that we need to do prior to June 5th, or do we need to wait? And that's the bottom line here, is that's the real question here. Do we do it now? Do we wait?
Madam Chair, as a follow-up, I appreciate you stating it so clearly now. I feel like before now it was slightly ambiguous, but just to put the meat on the table, the CDC has issued new guidance. Why, therefore, would we not incorporate it into ours? So I appreciate you bringing it straight forward. Thank you.
Mr. Chair, Madam Chair.
Yes, Ms. McBride,
like
Ms. Terracio, and then Mr. Livingston.
Yes, I am one that's data-driven, has always been data-driven, and has done pretty well being data-driven. The CDC guidelines state that they discuss those that have been vaccinated, fully vaccinated. They discuss family members, and there were also a number of contingency items in terms of when to go without a mask. So it just was not blanket beef mass free. So if you look at the guidelines, there were a number of different issues regarding how to use the CDC guidelines regarding using masks and not using masks. So it wasn't a blanket free mask guideline. Thank you.
Thank you, Ms. McBride. Ms. Teresa and then Mr. Livingston.
Thank you, Madam Chair. I'm not a member of this committee, but I would support if someone were to submit, or if this committee were to propose an amendment to the current ordinance to incorporate current CDC guidance. I think that would be reasonable, and I would support that.
Yeah. Thank you, Ms. Teresa. So to your point, the purpose of today's conversation is somewhat of a temperature check to see where we are in our conversation. I've already communicated with Mr. Brown that this ad hoc committee, we are in a global pandemic, and we are the coronavirus ad hoc committee, which means that we probably need to be meeting quite regularly. So I plan to call another meeting within the next week and a half, where this will be a discussion that we will be able to have more, where we more fluently and be able to make some concrete decisions from there. So thank you, Mr. Ratio. Mr. Livingston.
I'd like for our staff to go ahead on at some point and just incorporate those CDC requirements into our current ordinance for our consideration. At that point, then we can look at it and see whether or not that's what we need to do. And the reason why I'm suggesting that, because as I was looking at our ordinance today, currently the wording in our ordinance is in conflict with CDC requirements now. When we talk about, because of the increase in rates and different things that we have listed in our ordinance, because of that conflict, I'd like for staff to at least begin to look at how to make our ordinance at least consistent with the CDC guidelines.
Absolutely, sir. I couldn't agree with you more. I do think that is a great recommendation that we will ask Mr. Brown and his team to look at the most recent language presented by the CDC and marrying it with what we currently have as an ordinance, so that we can become compliant and consistent with the information that's being provided by the medical professionals.
Madam Chair, following up with Mr. Livingston, may I?
Yes, please.
I would like for staff to identify the areas where there is a conflict. If there are conflicts.
Very, very well. So, Mr. Brown, to clarify, what we're requesting from you and your staff is that you will take our existing ordinance and compare and contrast to the most current CDC guidelines. And as you are comparing and contrasting, if you will indicate those contrasts that we have in our existing ordinance, and then also make recommendation, including the most recent changes or the most recent guidance provided by the CDC.
Understood, and we will date that, so that way if guidance changes when we're presenting it, or the day before we present it, we'll at least have that most recent up to date before the next changes. So understood, and will do.
Thank you. And so before we do take up the last order of business on the agenda, I want the committee members to please make yourselves available as possible, because I do think that, especially with this mass ordinance, and if there is some inconsistencies in our ordinance versus what the CDC is saying, then we do need to reconvene quite quickly to address this matter, so that then we can in return present something to full council as soon as possible.
Madam Chair.
Yes, Ms. Newton, you're recognized.
Thank you. Just real quickly, I'm completely comfortable with us meeting more frequently. My request would be, if we're going to do that, can we at least collaborate via email to find a target day and time, so that we're not always trying to
arrange a schedule every 2 weeks, but that we just have a regular meeting that we can take or leave as needed. Thank you, Madam Chair.
Absolutely. I'm all for consistency. So yeah, we definitely can do that. I'll start the email chain in the morning for us to come up with a consistent date and time. Thank you. If there isn't any further, the last thing on our agenda is adjournment.
So move, Madam Chair.
Is there a second?
Second.
Ms. Mathis, if you will please call the roll for adjournment.
McBride,
Yes.
Livingston,
Yes.
Joe Walker. Joe Walker,
Yes.
Barron,
Yes.
Newton,
Yes.
motion passes.
Thank you, everyone. Until next time, we'll see you soon. Enjoy your evening.
Have a good night.